Okay, thank you. Thank you, everybody. Thank you, ladies and gentlemen. Welcome. Good afternoon. I see quite a number of you here. Some of our familiar Kayani family members. Welcome. Good afternoon. And I also see many new friends. I would like to welcome you very warmly to our new friends. I see Anthony Lai. I see Lily, Caroline in Singapore, Sulam. Maybe you all can type in the chat a little bit just to let me know where you are from, because I see some new names and I really like to get to know you a bit better. Okay, Sulam Yo, welcome. JT, Miss Wong, welcome. Okay, who else here? Linda, hello. Dorina, Dania coming on. Jenny, Tan Amai. Yes, I now see Miss Wong there. Okay, so this afternoon session is really to give a further explanation or details about our Kaini Triangle of Health. As you know, Kaini Triangle of Health, we have three components, and every single component of this Triangle of Health plays its own role, and it's really important. So maybe some of you would have already attended some of my earlier sessions where I talk about the foundations of health, what we really need to maintain our foundation of health and the basics of it. And so if you had missed that one, you can always ask your friend who invited you here. We have a replay. But today I just want to go deeper into the two important components of Triangle of Health, which is the sunrise and the sunset. So without wasting time, I guess I will just quickly start sharing. And maybe I just want to know in the chat, how many of you here are new to Kayani? You have not taken Kayani products yet, do not know much about sunrise or sunset as yet. Just let me know in the chat if you're new, so I can have a gauge here. Yes, Sulamyo, you're from Singapore. Okay, Dania from Singapore. Okay, so maybe as you go along, you can just type in if you're new and listening for the first time. Do bear with me because it is not difficult to understand, I would say, but sometimes we may have to listen again many times to be able to grasp of it. But basically, we are just looking into how we can help to protect your health, or to increase your wellness, to prevent disease, to avoid disease, or maybe to even reverse whatever disease state that you have through natural ways, through foods, okay, through foods that we can have in our daily diet. Okay. Okay, Sulamyo, you have taken Kaini products, but not the full set. Okay, it's all right. It's okay. Maybe hopefully today we'll give you a bit more intro to it. So maybe for those of you who do not know me, my name is Ilan. I am actually a pharmacist by profession. I graduated from USM many, many years ago. And along the way, I also did a master's in clinical pharmacy. And I was to practice. I have my own pharmacy in Malacca and I was running it for almost 20 years. But I've sold up that business about 5 years ago because I would like to focus on an area of wellness and health, which I think is very neglected, which is on wellness and lifestyle and preventive health. You know, I used to, of course, dispense medication, sell medicines to people, but yet I see that they are not really cured or treated in the disease. They are maybe controlled for a while. For example, like their diabetes is the sugar levels are good, the blood pressure is controlled with medication, it seems to be good, but it doesn't stay there. Somehow or rather, the disease is still progressing, they are still living with the disease, and it will, of course, eventually lead to more complications lah, from one disease to another one to another one. So medications can just do so much in terms of helping you to control that disease state. But what caused that disease in the first place is definitely you have to look back into that person's lifestyle. You know, you rewind back their life, maybe 5 years, 10 years, 20 years. What did they do or what did they not do that made them come into that disease state lah? So it could be definitely nutrition is a very big part of it. Could be physical activities, could be their stress levels, it could be many things that we do on a daily basis. So that is why I found that in my years of research, I've been doing this preventive wellness for more than 15 years. And this area took into a lot of things like weight management, obesity, smoking cessation. And that got me to now to where I am, which I have seen over the past many years when I have advocated this preventive and health, people have been able to improve their health, reverse their health, even, and I'm just very glad that, you know, just by creating this awareness and helping people to change their habits, making better choices in their nutrition, it can help them very, very much to live healthy, really, really healthy quality of life as we age. Like we always share in our group is that, would you like to live an age of a life of health, or would you like to just let it be default and come what may lah? If I find I got a problem, I go and see a doctor. So I would always say, please, your health is in your own hands. You are responsible for it. And this is how here we are to help you on this Kayani platform, how to live the best life and discover and practice what you can do to create that healthy life that you want. So that's why right now my title is a wellness and lifestyle pharmacist. Okay, I really help people and I serve people to achieve optimal health through better nutrition and lifestyle, so that you can avoid long-term chronic disease and of course avoid medications. So I got more than 30 years of experience in community health care. I'm really passionate about helping people to take charge of their health through this holistic wellness and simplified program. Okay, so just a disclaimer here, that whatever that I'm going to present today is just intended, not intended to diagnose, treat, cure, or prevent any disease. Okay, this clinical studies or things that I'm saying here is also not representation to Kayani products per se, but to the ingredients that we have in our products. Okay, so with that, let's move on. Okay, just for a start is this: if you want to get in shape, or if you want to have optimal health, that means you really want good health. Good health doesn't mean just that you don't have any disease. Good health is quality of life that focuses on everything, you know, including your physical health, your mental health, your emotional health, your spiritual health. All that actually plays a part in your overall health. But today's section, today we're just focusing on your nutritional health, okay, which will lead to your physical health. So in your nutritional health in our body, we must make sure, number one is your cells must be healthy lah, because your cells are made up, your body is made up of 37 trillion cells or even more. And number two is we must make sure that our blood circulation is good. If you have healthy cells and you have improved circulation to deliver micronutrients, to deliver oxygens to your cells, then definitely it is the path for you to maintain your health and improve your health. So today's session, I'm going to focus mainly just on your quality of health, the cells. Okay, number one. The part two of blood circulation, I'll do it next week when we talk about our nitro nutrition. So for today, I'm going to share a little bit about unhealthy cells and healthy cells. So all of us want healthy cells, right? Because in our cells, which includes maybe your heart cells, your eye cells, your brain cells, every part of your body function is made up of these small cells. And if your cells are healthy, doing the function that it's supposed to do, meaning your cells, if you look in the right side of the healthy cells, it is very nice and supple, the membrane is soft and permeable, so that your nutrients, the micronutrients can get in, oxygen can get in, and this nucleus is the factory in your cells that what it does, there's a process of metabolism that's in your cells, which uses the nutrients and uses the oxygen for it to generate the energy for your cells to function. And in that process, the energy that is used will release a lot of waste products. There's a lot of, in fact, we call it free radicals within the cells generated by your cells, which needs to be taken out. So if your cells are healthy, it can go through this process of getting nutrients in and getting the waste product out very efficiently. Thus, your cells are healthy, your function of the organs are healthy, and your body is healthy. Somehow along the way, your cells can become the one on the left, okay? Your cells can get damaged, your cells cannot do its function, whereby you see the cell membranes are not nice and round, it is maybe hard, it is rigid. So the nutrients that you take in your body cannot be absorbed. Maybe some can get in, but a lot of it cannot go in, and it's wasted. So these wasted nutrients are just maybe flushed away in your urine or so. And when your cells are not able to get the nutrients or oxygen in very well, this mitochondria will, your DNA, right? Will be damaged or it's not functioning. And that's where all these waste products also cannot go out. And thus within the own cell, the cell will be damaged, the cell will die. And when these cells start dying over a period of time, that's where your disease states come in lah. So when you say, hey, I got diabetes, I got cancer, I got heart disease, I got arthritis, it is actually all basically to this basic, just to this basic concept. If your cell's healthy or is your cell sick, okay? And this cellular death, right, it may not, you may not see it instantly because you have trillions of cells and your cells can repair and grow, or if your cells do not repair well, then as time goes by, when there are more damages to the cells, that's where you find that it's not balanced anymore and you start aging very fast, which comes with diseases lah. So this part is so important to remember, because what we are doing today in preventive health or in trying to reverse whatever health conditions that you have is trying to get you from here to here. Either you repair back your cells, you nourish back your cells, or you help your body to generate newer cells and to grow into and maintain them to be healthy cells. Okay, and this part of this number 3 here, you see healthy fats. These are the ones that's protecting your cells from this damage lah. I'll go more into to this later. So what causes this cell damage? Okay, so when I show you just now the unhealthy cells, so cell damage is basically caused by something we call free radical. Okay, if you don't understand this terminology, free radical in general term, we say it's like toxins lah. Okay, very toxin things that will damage your cells. And these toxin things can come from inside your body, and it can also come from outside your body. There's internal and external free radical. So internal free radical is what I mentioned just now. Through the process of metabolism within your cells, it generates those toxins inside. If you cannot flush it out or so, then your cell sort of kill itself lah. We call it oxidation. So that's where the oxidation causes the stress in your cells and cause the damage. But external free radicals, I think we are exposed to it every single day. In fact, every single second. Things like, radiation, okay? Radiation even from your handphone, radiation from the sun, radiation from all the gadgets that you have. Pollution, could be air pollution, could be chemical pollution, could be things that is around you that you're breathing in or you're taking in, consuming. Those things damage your cells. Stress, if you're highly stressed, you release a lot of free radicals in your body. That is why I think there are a lot of studies showing that the main culprit of disease is actually, one of the biggest culprit is stress. Okay, stress causes a lot of damage in your body. Very important is also poor nutrition. You are not feeding your cells with the right nutrition, with the right food, with the right micronutrients. We always say that you're actually, even though you're eating normally, but you may be starving your cells. Your cells are malnourished because of the food that we eat doesn't have enough nutrients, or your body just cannot absorb it. Okay, so if you're not eating properly, you're not conscious about what you're eating, or you're not making effort to feed your body properly, that will cause a lot of damage to your cells. And if this continues on, okay, some could be fast, can be slower. All this disease that we are really afraid of and we want to avoid, like cancer, aging, right? Aging too fast, premature aging, heart disease, diabetes, dermatitis, and a lot of other health complications will happen. So this is the reverse gear right now lah. If you don't want to get this, or you want to avoid this, or if you already are living with this kind of disease, is there a chance for you to reverse it back? Okay, to me the answer is yes. Most certainly you can reverse it back, so long as you take responsibility and do the changes. Okay, you must make an effort to make this change with the things that we are going to mention shortly. Basically, in this part is the nutrition is a very big part of it lah. Okay, let me just see in the, okay, I just have a lot of things on my screen. Let me just clear it a little bit. I think I have to clear the gallery as well. Okay, so let's talk about this cellular health very quickly to know what we need to do to nourish your cells. Because if you want to keep your cells healthy, you need to nourish it and you need to repair the damage that is done. Okay, so we can repair. Just like you have a flat tire in your car, you can repair the flat tire and it'll be running again. So likewise, we can repair your cells by protecting the cell membrane and also by giving it the right nutrients. So we know that how to do the repair is you need to feed your body with a lot of good nutrients. Basically, generally, we call it the antioxidants, okay? Because these antioxidants are the one that protect your cells. And many studies, in fact, I was just reading quite a lot before this. I wish I could put in more, but a lot of studies show that low dietary intake of fruits and vegetables doubles the risk of most types of cancer and of course aging diseases compared to those high intake. And it also markedly increased the risk of heart disease, cataracts. So why do we recommend fruits and vegetables? Because they contain very high antioxidants. They contain a lot of nutrients that protects your cells and repair your cells. Okay, so the problem is this. Number one, Malaysians don't eat enough fruits and vegetables lah. I think the study has shown 95% of Malaysians do not eat the 5 servings of fruit and vegetables a day. And the 5% who do may think that they will get enough nutrients, but they may not, because the nutrition in our food has really changed over the years. There's a lot of studies being done in many countries. I'm just going to show a very simple one, which is Japan, where if you assume that taking spinach can give you 100 grams of vitamin C in 1950, today you get only 35 milligrams. I will not go into detail very much, but it's just to show you that whatever you see that you're eating in volume, in vegetables and fruits, the micronutrients that inside may not be the same. Okay, and definitely we know the reason is because of soil depletion, and we know that they are losing a lot of chemicals and fertilizers that depletes the natural nutrients. Artificial cultivation, harvesting, and the way we cook our food today is also very different lah. So it's just that the quality of our food has very diminished in the micronutrients. And the other part of it is also we are eating a lot of other things that doesn't provide nutrients, quality nutrition to our body, which is definitely all these fast foods, processed foods, convenient foods, packed foods. They look good, but they do not certainly provide much nutrients to it. So besides adding in more of the fruits and vegetables, we also have to get rid of the things that we are feeding wrongly to our body. Then you will proceed into having very good nutrition. So this is where Kayani Triangle of Health comes in, because sometimes it is quite impossible for you to get all this every single day, right? I can eat healthy today, maybe tomorrow, but sometimes due to our busyness of life, we can't possibly have those healthy meals every single meal, breakfast, lunch, dinner. I think even if you ask your doctor also, do you have a healthy meal every single meal? They also will say no, they're all very busy doing things. And so in that process, you may deprive yourself of the micronutrients that is needed every single time, because we are alive. Our cells need those energy. So Kayani Triangle of Health is to help you to feed and nourish your cells with good micronutrients that's lacking in your diet. It is simplifying how we get our micronutrients in a way that so that we do not deprive ourselves of what we need on a daily basis. So I'll start to talk about sunrise, because sunrise is I would say, is one of the most concentrated, full spectrum superfood that will give you what your cells need every day. Basically, it has 70% wild Alaskan blueberry juice and 21 other superfruits. Okay, so Kayani Sunrise is basically originates from Alaska, okay, because the wild blueberries here is from the wild Alaskan mountains. And if you compare the blueberries from Alaska to blueberries that is cultivated or farmed, they have done this comparison. They show that the wild Alaskan blueberries has 5 times or even more amount of antioxidant potency compared to the normal blueberries. So if you go to the supermarket and you buy the blueberries and you eat it, right, most of that is definitely is cultivated blueberries lah. They farm it and they pick it. It is still good, but the amount of antioxidant compared to the wild blueberries that's used in Sunsight is totally far lesser. And what we have in this sunrise that is very makes it very effective is this flavonoids called anthocyanins. That's why it gives it the purple color. So if you look at the many types of blueberries, there are many types of blueberries, and we want to buy the big juicy ones, right? But our wild blueberry is called the Vaccinium alaskanse. This is the smallest one. It doesn't taste good. I've not tasted it before, but from what I heard of those who have tasted the wild Alaskan blueberry, it's very sour. It does. If you were to choose between this and this, you surely want to buy this lah, because it tastes better. But the potency is definitely in the smallest one, which is used in our sunrise juice. Okay, so why is wild better? Wild is certainly better, far more powerful than organic. Organic is still farmed, but it is farmed in a way that, of course, they avoid the pesticides and all those things. But while it's grown naturally in the wild, where these plants and these fruits, they have to survive on their own. So meaning that's why within the plant itself, it creates its own chemicals within the plant to protect itself from, let's say in Alaska, the harsh winter, the cold. So they need to survive there. So in the wild, naturally, the plant will have its own defense mechanism to protect itself. And when we take these wild berries, we are also getting those chemicals into our body that protects our bodies again from damages from outside. That's why it's a very powerful antioxidant. Okay, so it's just a chart here to just show how do we measure antioxidants. There is a term called ORAC. I think some of you may be familiar. It is called the oxygen radical absorbance capacity. If you don't know this, don't worry, don't need to remember. But it's just to compare from one fruit or one plant to another. How is it in terms of potency? So this study was actually done in one research center. It compares blueberries to black plum, blackberries, raspberries, strawberries, sweet cherries, avocado, and blueberries is certainly on the higher list. Okay, so it's actually the king of antioxidant, very, very potent here. So sunrise here, besides our blueberry, we also have 21 other ingredients, mainly from fruits and vegetables again, that has been carefully selected to give you the complement, the synergistic effect, the complement, the blueberry, to make it a very powerful micronutrients that your body can easily absorb and use in your cells. So we also have things like pomegranate, we have mangosteen, we have acai berry, aronia, grape seed, and grape skin also, maki berry, kale, aloe vera, broccoli, spinach, cranberry, red raspberry, wolfberry, ashwagandha, some ginseng, amla, and these are things that is, even though it may appear in very minute form, but each of these will have in micro, that's why I call it micronutrients, right? You only need it in very micro form for your body to use it. Okay, so all in a simple pouch of 1 ounce like this. And the amount of nutrients in there here, because it comes in its natural form, is something like the vitamin C of 8 apples, or the vitamin E of 80 cups of broccoli, or vitamin B1 equivalent to 96 cups of kidney beans, or 2.3 liters of green tea for the L-theanine. L-theanine helps you to relax, you know. So we have all these natural, I would say, vitamins within these natural fruits and vegetables in our sunrise to provide you with all these almost 74 minerals and trace minerals within this sachet. Okay, as you know, minerals and trace minerals are also very important in our diet. Without it, you have a lot of problems as well. So this is where you can go juicing if you like, or you can also just take a sachet of sunrise every day. I take it in the morning. Some people take it 2 or 3 times a day, is also fine. Or you can always also add in a packet of sunrise. If you love juicing, you like to do your beetroot juicing or your carrot juicing, go ahead. But if you add in another sachet of sunrise, it's going to make it really very, very powerful. Okay, so what are the benefits of let me just see, benefits of this blueberries? Okay, so basically the benefits of the blueberries is because of the anthocyanins, okay, these purple pigments that helps in many things like brain function, physical strength, blood sugar, cell function, immune system, heart health, cholesterol levels, vision, okay, better eyesight and better sleep. I've already broken down, I was doing a bit of research and I've just highlighted a few things that I would like to stress on. So this one by Dr. James Joseph, he's a lead scientist in this laboratory of neuroscience here. He says that when it comes to brain protection, okay, if you really want to protect your brain cells, you want to make your brain healthy, functionable, there is nothing quite like the blueberries. That's why they call these blueberries the brain berry. So if anything to do with the brain, it could be your cognitive function, you want better memory, you want better focus, you want more concentration. And even children, you know, if the children who are probably hyperactive or they're going through some autism spectrums, or if you have some brain problems like maybe going through some anxiety, depression, maybe showing signs of dementia, Parkinson's, Alzheimer's, things like that, it's actually has got to do with the brain function. blueberries can help very much. There are really a lot of research into it. You can go to Google, but go to PubMed. You can just key in blueberry and Alzheimer's, blueberry and dementia. You just key in like that. You will see a list of people. A lot of scientists are doing studies into these areas. Okay, so one of the very common studies, in fact, why I say common, because scientists are still very intrigued about how this little berry can do so much of wonders in protecting your health, like reducing your DNA damage. Like just now we are talking about your cells, the free radicals can damage it, but blueberries can reduce the damage. And when you can reduce your DNA damage, you will certainly protect your cells against aging and cancer, right? Cancer is caused when your DNA has already become abnormal, is behaving abnormally like not a normal cell. So blueberries has been shown to be a very important help, I would say, protection against aging and cancer. And another one, definitely blueberries protect cholesterol in your blood from becoming damaged. So as we know, cholesterol is one of the risk factors. High cholesterol is one of the risk factors to heart disease. And every time when we go for blood tests, right, we're always so curious, how is our good cholesterol? How is our bad cholesterol? How is our triglyceride? What is it, high or low? So actually your LDL is supposed to be your bad cholesterol, right? But in a healthy person, right, the LDL may not cause damage to you or may not pose a risk to your heart disease if you have healthy HDL. That means if you have a good cholesterol, to bring this LDL bad cholesterol to your liver, it will be excreted. Or another way is definitely if you have enough antioxidants in your bloodstream to prevent your bad cholesterol from being oxidized. Because LDL, as I said, is not dangerous, but if this LDL is being attacked by your free radicals or being oxidized by your free radicals, it changes into a bad form, a bad LDL, okay? And this bad form of LDL becomes very sticky, and that's where it's going to stick along your arteries and cause the buildup of all these plaques, which eventually it will cause a blockage and may cause your heart disease or may even cause your stroke. So if your LDL is not protected by antioxidants, then your risk is high. But if you take something like these blueberries or antioxidants in a way, it's shown that it can prevent your LDL from being oxidized, and thus, if it's not oxidized, what it does, it will be transported to your liver, and that's where your liver will get rid of this bad cholesterol. Okay, so this is a very important point to understand your cholesterols in your body. It is not so much about whether it's high or low, it is whether your LDL is oxidized, damaged, or your LDL is free flow. Okay, that means it can flow back to your liver and be excreted. Okay, so this is if I know I take my blueberries, I know I'm giving my cholesterols well protection. And a lot of our friends here who are on this sunrise, they all have shown reduction in their cholesterol levels. Okay, right. This is again, many things on my screen. Okay, this is another benefit of blueberries, which it may help to reduce blood pressure. Okay, in Malaysia, one in 3 adults have hypertension, and 50% don't even know they have hypertension. So it's pretty risky. So when you take blueberries here, in this 8-week study, they show that people who are actually obese and they have a high risk of heart disease, they noted a reduction of about 4 to 6% in blood pressure after taking 2 ounces of blueberries per day lah. So this was actually printed in this journal. So meaning that blueberries can help to bring down your pressure for those who know it or even for those who do not know it, okay? And this daily blueberry consumption not only improves this blood pressure, but it also prevents the arterial stiffness. That means your blood vessels doesn't become too rigid, it becomes a bit more flexible in postmenopausal women. So this study was done, another study was done in another group of people, which is people who are menopause like me, okay, who are having pre-hypertension or maybe early hypertension in this clinical trial. So for postmenopausal women, I believe definitely this blueberries and sunrise is something that will help you very, very much, especially as you know, when our estrogens and our female hormone is down, our risk for heart disease increases very much, okay? So I feel really assured that I'm able to help myself in my postmenopausal period, okay? Now, the third one is, just now we were talking about cholesterol and blood pressure, which is actually the risk factor to heart disease. But what about heart disease itself? how does it directly impact this heart disease? So I found this study where they did you call it an observational study with 93,600 nurses, and they took a lot of antioxidants, mainly anthocyanins, okay, like blueberries, and they found that they were at a 32% lower risk of heart attacks compared to those who take very low intakes or do not take. So this risk reduction in end stage, that means which is the heart disease, is very significant. You know, you reduce by 1/3, okay, if you take antioxidants, mainly anthocyanins. So I'm also very impressed with this study where there's quite a big number of nurses here, okay. And next, we also, like I mentioned just now, the brain function and improved memory. Uh, I think I can't say enough about this because there's really a lot of studies on it. I will not elaborate too much into that, but basically it goes into the areas. Number one is like intelligence lah. So if you want to maybe be more intelligent in a way, because you can think faster, right? Your cognitive function is faster. It helps you very much, and it also benefits the neurons. Remember, what I read about is also as we start aging, we are always afraid that our brain cells will die and we get lesser and lesser brain cells. Thus, of course, with lesser brain cells, the function of your brain gets weaker, right? But according to this paper that I read just now, it's not just about your brain cells getting lesser. You may have enough brain cells, but your cognitive function can also diminish because of neurons. That means the signaling from cell to cell is inefficient or damaged. So if this cell signaling is damaged, that means it doesn't tell your brain what to do. From this part of the brain, it doesn't communicate to that part of the brain. And that can cause, of course, memory problem and brain function problem, even though you're young, okay? It's not just old. So if you are having this kind of problem where your thinking is very slow, your thoughts are very slow, this could be one of the reasons. That means your cell signaling in the brain got problem already lah. So blueberry and anthocyanins help in this part very much. It helps to make the highway faster, okay? That means these aging neurons or neurons in your brain can continue to function. Yesterday, we actually shown the talk by the neurologist, Dr. Noreen Trinidad. It was a very, very informative session where she spoke a lot about these neurons in your brain and how our Kayani Triangle of Health can really help you very much here. Another study also, they found in about 16,000 individuals that blueberries and strawberries can delay mental aging by almost 2.5 years lah. So many studies actually. In a nutshell, if you want better memory, you want to improve memory, and you want to protect your brains from early aging or nyanyuk, then this would be a good way lah. Take 1 sachet or 2 sachets of sunrise a day. Okay, anthocyanins in blueberry have anti-diabetic effects, which is true. It helps in insulin sensitivity and help you to metabolize your sugar faster. Okay, some people when they take sunrise, they say, hey, how come my sugar went up instead of going down? Is it very sweet? So in this case, 1 sachet of sunrise has only 6 grams of sugar, which is very, very low. It's like a sugar of half a banana or 1/3 of an apple. So it is actually very low sugar. But in the process of maybe you are changing this nutrition, your sugars will become a bit haywire in the beginning. But be persistent, because it certainly doesn't raise your sugar level. In fact, the GI is very low GI product as well. But it will really help you in the long run with this insulin sensitivity and metabolism. Okay. Other benefits that you may have for anthocyanins is it helps to reduce muscle damage after strenuous exercise. If you find you have muscle soreness after exercise, usually you can take a sachet of sunrise. It will help you to recover faster. You don't feel so tired. And I know a lot of you here are doing just that. And you will find that it helps in your post-recovery, okay? And it also helps to fight urinary tract infection. Okay, as you know, cranberries and the berries are very good for that. If you're prone to having this infection, it will help you. Mainly, I believe it's because the berries feeds your good bacteria, okay? It helps your good bacteria to grow more than the bad bacteria. So when you have a balance of more good bacteria compared to the bad bacteria that causes this urinary tract infection, definitely it will eventually not happen, okay? So for long term, if you are prone to UTI, this will be good for you. Okay, so now it comes to this, whereby Just now I mentioned 94.9% of adults do not take the recommended 5 servings of fruits and vegetables a day. This was studied in our National Health and Mobility Survey in 2019. Because maybe they have no time, or maybe the quality of food is bad or so. So if you take a sachet of Sunrise a day, it is really equivalent to giving your body all these fruits and vegetables and 5 servings of it a day. That's why we call it a wellness simplified. It doesn't mean that if you take this, you're not going to eat your vegetables. No, you still please take your vegetables and fruits because you need it for other purposes like your fibers and all. But by taking Sunrise, I would say you feel reassured that you get the micronutrients that your cells need. So love your cells, feed your cells, don't starve your cells with unhealthy foods, but feed your cells with quality food that helps them to function. Okay, so ultimately you ask, how do I take it? Who can take it? Well, for adults, you can take 1 to 2 sachets a day. Normally, I can take it in the morning. I find first thing in the morning after we take iNitro, we take our Sunrise. You can take it on empty stomach if you're all right, or maybe if your stomach is a bit sensitive, take it after your breakfast. It is also fine. You can drink it neat like this child, or you can also mix it with water if you think you want it diluted, or you can mix it in your cereals, in your yogurt, make it in a smoothie. It is fine. Any which way is fine, because as long as you get it in your body, it will definitely help you a lot. So for children, I would not less than 1 year, I wouldn't recommend because they're still young, I would say. But maybe over a year, you can give them about half a sachet, half a pouch will do. You can dilute it into a drink. And for those above 4 years, I think it's pretty fine to take 1 sachet a day. Nothing wrong also if you give 1 pouch to 1-year-old. I think nothing wrong. It's just that maybe they don't need that much, or it may cause maybe a bit of loose bowels also because of the amount of fibers also. So go accordingly, I would say. When you give to your child, observe what are the changes also. But I would recommend that you give your children this. You don't have to buy the multivitamins or so from the pharmacy, those kind of things, because those are to me, I find they're not very complete. There is some vitamins and minerals there, but it may not be very complete, and it may not be in the form that is easily absorbed by our body. It needs to be digested. And of course, those vitamins is always been prepared in a way that the children will like it. So they have a lot of sugars in there. They put a lot of flavoring, coloring, which I would not recommend. So go for something natural like Sunrise. This is really good enough for the kids. This is actually Linda's grandkids who love the Sunrise very much, and it has really helped them to enhance their immune system. They, according to Linda, they seldom fall ill, or even if they do, they recover very, very fast. Okay, so if you have any questions, you can always type in the chat. I will go to it at the end of the session. Right now, I want to go to Sunset, right? So Sunset is the fat-soluble antioxidants that will help you to protect your cell membrane, and is also to help you to reduce inflammation in your body. As you know, inflammation is another big word in health, because inflammation is the cause of a lot of diseases as well. Things like allergy, arthritis, cancer, heart disease, diabetes, autoimmune disease. You see, there's an overlapping of a lot of things. This disease is caused by inflammation, is caused by free radical attack. So all these things that wants to damage and hurt our body and cause disease can be overcome again through lifestyle and nutrition. So here's where Kyani Sunset plays its role, because Sunset here, looking at this chart again, it helps in this providing the healthy fats to protect the cell membrane. And if you look at this here, all these are the antioxidants that how you say that makes a barrier, okay, that makes a barrier to the cell, so that it can decide what to let in and what to let go lah. So it's like a tembok with a gate. So they open the gate to the nutrients, but it will close the gates to the toxins and free radicals. That's what it is. Okay, so the more fat-soluble antioxidants you have, the thicker the protection of your cell membrane. So protect your cells with these healthy fats. And what Sunset is about, it consists of our omega-3, as we know, our fish oils, omega-3, mainly from wild fishes and wild Alaskan sockeye salmon. Again, we are sourcing it from the wild, because the wild is always the best. And we also have another important ingredient, which is our vitamin E. But this vitamin E that we have is tocotrienol. Okay, tocotrienol is the more potent form of our vitamin E. I will explain after this. and we are sourcing it from this annatto seed. And besides these two, we also have vitamin A, that is another form of fat-soluble vitamin, and vitamin D. So this is a very powerful formula that provides you with this fat-soluble antioxidants. And while again, if you look at some of these videos of this sockeye salmon, they will swim upstream in these Alaskan mountain rivers. And here the waters are so pristine and so free from pollution. So when you have your sources from this kind of fishes, you know that you're taking in very, very quality omega-3s here. Very beautiful place. And we also have, to assure you that the fish oil is clean and so, we have this IFOS, International Fish Oil Standards, rating 5 stars, where meaning that this fish oil is free of contamination, free of radiation, free of mercury. That's why we can safely take this fish oil for ourselves, for our parents, our aged parents, and even for our children, because fish oil is definitely good for your brain health, as we know, for children. And we also have this award that's given called the Mondi Selection Award. It is a consumer award whereby it evaluates quality of products like this. And this is not just a gold award, it's a grand gold award, which is the highest award. So I'm very assured that this fish oil that I'm taking is definitely providing me with quality and safety. Because there are so many fish oil in the market. I really, when I was in the pharmacy, there were so many brands. If I look at it again, definitely I will not be choosing those brands for looking at certifications and quality like that. Okay, so let's talk another part of the sunset, which is the tocotrienols, the vitamin E. Now, I think all of us would have heard of vitamin E, which is, we know, is very important for our health, but mostly we are familiar with this E called tocopherol, okay? And a lot of vitamin E products in the market, they use this tocopherol because it has been earlier research, people know about it, and the sourcing of it is quite easy to get. But of late, about 10 to 20 years ago, the scientists have discovered there's another group of vitamin E called the tocotrienol. And this tocotrienol is very, very potent, more potent than the normal tocopherol. So they find that tocotrienols can repair your cell membranes 50 times faster than tocopherol. So remember I was telling you, if your cell membrane is damaged, we must quickly repair it and protect it. So if this vitamin E tocotrienol can repair it faster than the normal vitamin E, most certainly it's going to help you recover, right? And help your cells to function again. So for that matter, tocotrienol is selected in Sunset because of its efficiency and potency. And here we are getting our tocotrienol from this fruit called annatto seeds, very small like rambutan like that, but very, very pure tocotrienol. There are many sources of tocotrienol, like in Malaysia, some of them they use from kelapa sawit or palm oil. However, our palm oil contains a mixture of vitamin E. It has tocopherol and tocotrienol as well. So if we do not separate these two, then there are some studies showing that the tocopherol may block the absorption of tocotrienol as you consume it in your body. So that's why Kyanie doesn't take that source. We use annatto because annatto is 100% tocotrienol. There is no tocopherol inside. Okay, and these are some of the studies that shows the benefits and why tocotrienol is so important. Again, just like blueberries has its own usage for cholesterol, tocotrienol has also very high evidence to reduce your LDL, okay? And but this time around, it's reducing your LDL not by the oxidation process or antioxidant, it's by reducing the activity of your liver making the cholesterol. Okay, your liver can make the cholesterol, but it is actually blocking your liver from producing too much cholesterol. So I think perhaps those with family history of high cholesterol tocotrienol will help you to bring down your cholesterol level this way. Okay, so that is one. And this is another study showing tocotrienol helps to reduce your risk of Alzheimer's disease. Okay, it prevents this Alzheimer's disease because the oxidative stress and the free radicals that damages the brain cells is protected and blocked. And also it has a lot of, they call it neuroprotective activities that reduce inflammation. So in short, in a nutshell, if you don't understand this, it just says that it can help you to protect yourself from Alzheimer's disease and reduce inflammation in the brain cells, okay? And this one is the study on tocotrienol in your overall cholesterol. Over here, you can see it can reduce your total cholesterol by 15%, your LDL by 14%, and even your triglycerides by 18%. So over here, Sunset actually has been tested by experts and clinically verified that it can reduce inflammation by up to 90%. That is a very powerful statement to say. 90% is very, very high score. Okay, so for the fish oil, we know it helps in cardiovascular health, inflammation, cholesterol, blood sugars. It's very essential for pregnancy in development of the infant's brains, and so those pregnant women can take Sunset very safely. As you know, we have our standards there, so it's very safe. It's very good for your vision, your eyesight, brain health, memory, improve your mood and stress, and of course, better sleep. I've done also a little bit more extraction to further elaborate on the usage of tocotrienol, because again, there are so many research being done now in tocotrienol, and it's going to be seen and used very, very much more. Even the doctors and clinicians are using tocotrienol to treat their post-stroke patient, because it promotes blood circulation as well as reduction of stiffness and blockages in the arteries. Okay, that is one. So now this study here, it says that it can increase life expectancy in cancer patients. Okay, all this that I'm saying is actually I'm extracting from a study, but I did not put all the references because it's a bit too much to do already. But I was reading and I was extracting it. So in these human cancer trials, they were shown that it can almost double the overall life expectancy when taken with standard therapy. That means you must get treated for your cancer through the normal way, but when you take it concurrently together with the treatment or in the process of receiving your treatment, it can actually extend the life expectancy, and it also will hinder or prevent the rapid multiplication of cancer cells. Okay, so if you want to avoid cancer, or if you're having cancer right now and you're looking for some support in nutrition and supplement, tocotrienol is something that I think you should consider very strongly. Okay, number 2, it supports cardiovascular health, again for lipid lowering and reducing the inflammatory response I said earlier. Now, improving bone health, this one is a trial of that postmenopausal women. It has demonstrated to resist bone loss. So, as you know, osteoporosis is one of the big concerns of postmenopausal women, whereby we actually will bonko a lot, or we are at risk of all these fractures if we happen to fall or so. And most of the time, doctors prescribe them some medications to protect these women or prevent these women from having osteoporosis. But I believe that we do not need those medications if you're not sick, right? But through natural forms like tocotrienol, you can avoid or prevent yourself from osteopenia or osteoporosis in the long run. Okay. Number 4, fat in the liver, or we call it fatty liver. Now, fatty liver is, or we call it non-alcoholic fatty liver, because it sounds fatty, but fatty liver is not caused by fat actually. Fatty liver is caused by extreme carbohydrates and sugars that's not utilized, but converted to fats and stored in the liver. So in US, like here, they say 25% has fatty liver. In Malaysia also, we have very high population with fatty liver, especially if you're overweight and obese, you will have some sort of fatty liver. When I was admitted for my dengue once, I was sent for a scan, and they were telling me, hey, you got fatty liver. And that was about 4 years ago. I was that time going through menopause and I was overweight. And I'm glad, of course, I don't have it right now. But as you gain weight, you will surely have this kind of fatty liver. So tocotrienol here has been seen to reduce both fat and enzymes in the liver. It can reduce inflammation in the liver. And those people who actually went through it, they also saw an average weight loss of about 10 pounds. So there is no specific treatment for fatty liver really. Doctors will always tell you, go and lose weight, go and exercise. But we know also, besides that, you can have tocotrienol to help you to improve fatty liver. And of course, fatty liver is not been addressed, it may lead to other liver conditions like liver cirrhosis, and it may also end up as a liver cancer. So address this concern. Fatty liver is not something to just take it lightly. Number 5, it promotes cell health. So like I said, our human body has a lot of cells. It protects the membrane of your cells so that it prevents the free radicals from attacking. Okay. Number 6, it keeps inflammation at bay. Again, there are many things that's associated with inflammation. is important. If you have any autoimmune disease like arthritis, even psoriasis, rheumatoid arthritis, diabetes, cancer, heart disease, all these inflammatory conditions, even joint problems can be helped, okay? And upholding a healthy blood sugar level, again for diabetics, this is another natural way that you can help to improve your insulin sensitivity and let your body process the glucose better. Now this photo that I'm showing you is a real reading from one of our Kynie users. When she first started, before that, she was on insulin, she's on medication, but her sugar is always hovering about this 17.4, very high. You can see the date here is 27 of February. After she has taken Kyanie for 1 month, you can see her sugar has now gone down to 7.8. The date is 28 of March, okay? So this was a very amazing reduction for her, because she said she's been trying so hard to reduce, but it couldn't. Even with the insulins, it couldn't control. So this was a very good, really a good testimonial of how maybe the whole triangle of health, including the sunrise, sunset, and nitro, has helped her to stabilize her blood sugar. Now, number 8, about brain health. Again, just now I've mentioned in that study, if you really want to avoid or slower the progression of your brain aging, where there are many studies being done, and we are all afraid of Alzheimer's, because Alzheimer's is real, it really happens, and your risk is very much higher when you reach 70. It will happen. So don't let your brain shrink like that so fast. Make sure that your brain is kept healthy, okay? Tocotrienol is one of the things that can help you. Now, if you want healthy skin, if you want radiant skin, if you want to reduce your pigmentations or avoid skin damage, or you want to repair it, tocotrienol is one component that is very, very important. It's also really effective for wound healing. Okay, if you have a wound that's hard to heal, it can help. It can protect you from light exposure, which eventually we want to avoid skin cancer, and also autoimmune disease, things like psoriasis and eczema that I mentioned again. So tocotrienol is very important if you have any skin conditions that you would like to improve. Now, provide radiation protection. Yes, any form of radiation. It can be radiation through sunlight. It could be radiation through your mobile devices. It could be radiation through treatments. When you go for whatever treatment that you have, it helps to protect yourself. 11, promotes healthy vision. I was just reading this article, but I didn't have time to really extract the gist of it. But what I read was it will help you for diabetic retinopathy. In fact, that same person who was, when you saw there's not the blood sugar going down, she just did a diabetic a checkup with the doctor, and the doctor found that her diabetic retinopathy has reversed. Okay, there are less bleedings in the eye. It will slower also the progression of cataract. And those who have gone for glaucoma treatment, the study showed that it improves scarring from the glaucoma, and it also reduces macular degeneration. So if you really want to protect your vision, your eyesight, tocotrienols is one key component that can help you. Another one I found very interesting is about hair loss, okay? So if you're having hair loss, your hair is dropping a lot, or you just want to have better, more beautiful hair, then tocotrienol supplements increase this number of hair on the head, okay? This is one study that they did. So there is hope, okay? If you're losing hair and you want to have more hair, this is one of it lah. So that's generally, actually, there's a lot lah. There's the research is coming in more and more about the usage, and we are so lucky to have this product that has both omega-3 and tocotrienol in one to give us all these benefits. And one of the things that I hear also, a lot of our clients who are taking it, it improves their stress and improves their mood. They find that they don't get angry fast, they don't get agitated, they feel calm, very patient, less anxiety. And because of that also, they make them more relaxed and they sleep very, very well. So for those of you who have sleeping problems, you don't have good sleep, I think you definitely need to try Sunset. Please don't go for the sleeping pills first lah. Try the natural form, because sometimes all your body need is just something to relax, to help you to relax. And this is what Sunset can do for you. Okay. So with that, you have a peace of mind to consume, because our product Sunrise Sunset has been certified so by many external certification centers. All these things you can actually get the new information from our website to know what are these certifications. But these third-party validations help you to be reassured that our products are safe, pure, and very effective for you to use long term. Okay, because these are long term nutrition, these are food. So we want to make sure that we take it safely. It doesn't cause damage to your liver or your kidneys or so lah. So this complete wellness solution, like you can see, there's a lot of overlapping benefits in both. So sunrise and sunset both helps in the vision, helps in the brain, helps in the heart. So when you take it all together, it's going to give you this synergistic effect. Okay, and because of its form in the liquid form, sunset is in a fish gelatin. It's a very small capsule. It's in a fish gelatin. Let me just, yep, I have it over here. Okay, if you can see it, it is just a very tiny compared to the normal fish oil, and the gelatin is fish, meaning that it can be dissolved so easily in your body. So when you take it, absorption is very fast, and it will just, with a good circulation, it will be delivered to your cells. Okay. So lastly, before I end, just to share some of our testimonials and stories. Actually, personally, this is me. Overall, I say I've been taking very good care of myself until I reached my 50 plus, where I was getting menopause, and that's where one of the big issues was my hormonal imbalance that caused my weight gain. And despite taking supplements and all that, I don't seem to be able to help myself. But Kayani Triangle of Health has helped me within that 6 months to lose my weight back again and to improve my quality of life. I would say that even though I'm a supplement taker for many, many years, I think this, after taking Kayani now almost 2.5 years, it has really gave my health level, brought my health to a different level. I think at 55 today, I feel so much fitter than ever before, and it's given me a really, a very confident, I would say, very confident uh, progress from now on as I start aging. Okay, and another friend of ours is tripping as well. She's also in her 60s, but again through Kayani Triangle of Health, it has helped her to transform a lot. You know, giving her a lot of energy, and she's also in a very tip-top condition right now. And if you see her, the new tripping right now, she's in a 90-day challenge that has really made her lose a lot of weight, 11 inches off her belly. It's just because of the way we nourish ourselves with the right nutrients. Our chemo marathon to fitness warrior here, Datin Fuziana, she fought through her cancer, and being on Kayani Triangle of Health, I think for almost 2 years right now, has further strengthened her recovery and improved a lot of symptoms that she had earlier on, like cramps, numbness, low energy. Even her cholesterol have improved so much right now, and her PET scans, her latest PET scans, has shown that her cancer is really very well controlled and in remission. Yep. My neighbor Li An, who had 2 strokes before this, also was not in a very good shape, weak, overweight. But since taking Kayani also almost 2 years ago, more than 2 years ago, when I introduced it to him, his quality of life has improved so much. You know, up to now he can hike up the hills, he sleeps better. He says his breathing is deeper. He has more strength in his joints and his muscles, and he just loves to exercise now. He works out very often, and he's getting, as like he said lah, I'm healthier now even before my stroke, because before that he was really not having a good quality of life. Okay, and this is Mazila, the lady that I was telling you about. Besides her sugar coming down, her wound has also healed just within that 1 month. Okay, and Linda is our super glamour, again a very good friend of mine, who has been going through post-surgical menopause for 11 years, having a lot of issues with her health. But since starting Kayani early last year, she has lost weight, she has reduced all her swells in her ankles, and her migraine of, I think since she was 12 years old, is also not eminent anymore. She doesn't have those migraine attacks, no more heartburn, her pressure is well controlled, her sleep quality is there, and her kidney function that was actually not doing too well has also gone down to normal. So these are the people who have really improved so much. They have reversed their health into making it into a different level of a level that they never felt that they could achieve lah. So to end is this lah, definitely is, what are you feeding your body daily, or who are you feeding? you know, what I mentioned, who is definitely we are feeding our gut bacteria. And what are you feeding? Are you feeding your body with good food, or are you feeding your body with junk food? Because if you feed your body with good food and good micronutrients, most certainly your body will respond very well to help you to attain the health. But if you're feeding your body with poor quality food, you know, like fast food, fried food, processed food, you know, even once in a while, I would say you make it a part of once in a while, you're depriving yourself from really getting the best. In fact, you're just feeding your tongue. You're not feeding the body at all. So you got to have a little bit of a balance to know what you should be doing more and what you should be doing less, or what you should be omitting in your diet. So it really costs money to stay healthy. I know yesterday I did my shopping. I spent almost 500 plus on just one trolley of vegetables and other things that I need. But I think it's worth it because I know I'm feeding my body with good nutrients. Because 500 ringgit, you can't even pay one day of hospital, you know, if you happen to land up there, you know. So take care of your body is the only place you have to live in. Okay. Yeah, I know it's very long and draggy, but I'm so passionate to want to share as much as I can with you from what I've discovered, and hopefully this has been helpful. If you have any questions right now, please feel free to ask or so. I'll be happy to take your questions. So far, is it okay or not? If you can digest 10%, I'm quite happy already lah.
Very good, very good.
Thank
Anthony.
you. Oh, Anthony, you're from where, Anthony?
I'm from Singapore.
Oh, okay. Yeah. Okay, you're in our 90-day challenge group, right?
Yeah.
Yeah,
Thank
right.
you.
All the
Yeah,
best.
thank you.
Thank you, Danya. And I see a Lily here, another Lily there. It's from Singapore also.
Yes, I'm from Singapore.
Okay,
Thank you for your sharing.
Thank you. And Alicia, also welcome. Good to see you again. Welcome.
Thank you for sharing.
I can drop the nitro into our eyes, but is it safe? As all eye drops are sterile products, and the pharmacists always tell us the eye drop, once open, can only be used for 4 weeks.
Oh, okay. Yeah, now I see the question here. Okay. We don't advocate putting nitro in the eyes. Definitely not. Nitro is for your consumption. But I know of some people who put it in the eyes. You're correct. Exactly, you're right. Our products are not sterile for the eyes. It's meant for consumption. Okay. So while it's not harmful, because I know people are doing it, they find it's okay. I personally do not advocate putting in the eye. Okay. And definitely once it's open like that, the tip is open, it's contaminated. Okay, we don't want to put those things in the eye. So I personally do not recommend dropping in the eye. It's good enough to consume it. If you consume this nitro, it will help in the eye microcirculation. You don't have to drop it in the eye for microcirculation. Consuming it will help microcirculation. Is good enough. Okay, for me that's my take lah, and I think most of us here are doing just that. If other people are dropping in the eye, it's their choice lah. It's their choice. Okay, I will not comment on that. Is that okay? Yo, Su Lam Yo, I think you're the one who are asking that. Yeah. Okay.
I'd like to check with you. After taking sunrise, right, is it advisable to drink warm water or hot water immediately? Is it good? Does it actually destroy the nutrients?
No. The nutrients will be destroyed when you boil it or so lah, under intense heat lah. But normally I wouldn't drink hot water after I take sunrise. I would, if you want to take warm water in the morning, which I know is quite good, right? I will take it in the morning. Like when I wake up, I will drop my nitro first. Okay, I will take my nitro. After that, you can drink your warm water. You can drink your glass of warm water, or some people take, I don't know, 8 ounces or so. I think that will be a very good time to get your whole body starting, you know. So take it at that time better. Then after you have your sunrise, if you just want to wash it down with some water, it is fine, nothing wrong. But I don't need to take hot water or so after sunrise. Okay. I think drinking water on empty stomach is better in the morning. I think that's because you already slept for 8 hours, you know, your body doesn't have any hydration then. Take it in the morning, that will be the best time.